Okay, well, now let's move a little bit on to home territory and talk about the crisis of healthcare. There are 46 million people without healthcare insurance, and this was an issue that came up nationally previously, and there's a ballot initiative in California to have a single-payer system. Why don't we talk, the candidates talk about what their view of the healthcare crisis is and what the solution is for the United States as far as the healthcare. Philip?
Healthcare in this country was essentially socialized in the 50s by Nancy Pelosi's predecessor, Philip Burton, when he declared that all hospitals, by force, must treat people regardless of their income when they come to the hospital. Prior to that, if people were sick and they didn't have any money, there were charitable hospitals, or there were urban hospitals that were funded locally, or doctors individually, out of their own compassion, took care of people, and so the compassion, the individual compassion, the private compassion, was destroyed by forcing hospitals to take care of poor people. And so the government has gotten involved in every aspect of medicine, and it simply doesn't work when the government does things. It's like the post office. It sort of works, but it's not very compassionate. And if the medical system was completely taken over by the government, it would work as well as the Army does in Iraq. Or any other government activity. There's just no incentives to do things well. There's no incentives to do things with compassion. And it also destroys people's compassion because they say, I already gave 50% of my money to the government. I'm not going to help anybody, even in my own family.
Okay, thank you. Mike?
Well, I think the American people are not so much concerned about where their health care comes from, whether it's through the government or through a private source. What they're concerned about is quality health care. We have the example of Canada, which has single payer. Go to Spokane, go to Seattle, go to Detroit, go to Portland. Every one of those hospitals along the border are full with Canadian patients. Because to get into a hospital in Canada is a question of waiting online. In England, where they have single payer, if you need dialysis and you're over 55, they send you home to die. When you have single payer, government-sponsored type of healthcare, you create shortages because you increase the demand for something without being able to increase the supply. And for that reason, it is essential that what we do is reform the private type of healthcare, make it better, make it more affordable. The 46 million, did you say, who supposedly are without health care, my understanding is half of them live in households with over $76,000 in income. And a good number of them are people who self-insure or choose not to have it. Now, if there are those without it, as Philip just told us, any one of them can go to any hospital in this country, and by law, they must be cared for.
Chrissy?
Well, I'm for a single-payer healthcare. I'm for socialized medicine. I'm for reclaiming the federal government, which I think is where I totally differ from both of my colleagues here. I think that our federal government has been completely undermined by the Republican Party and the Bush administration, that those are our tax dollars and they should go back into all of our cities. I think all the mayors in the country should go on strike together, as well as the governors, to get that money back. We could have fabulous hospitals. We could have beautiful parks. We could have fantastic roads. We could be investing tons of money into solar energy, tidal power, all the different ways that we could, make up for the fact that we're going to be running out of oil. If we could take those federal dollars that are being wasted, that are being used by the Republican Party to pay off large corporation debts, use it for our needs, we could make a garden again of this place. And the money's there. I pay taxes, and I don't care if I pay for my health care or my daughter's or my next door neighbors, but I know the money's there to make wonderful, fabulous hospitals and health care for everyone.